Hello, this is Dr. Vasan, cosmetic plastic surgeon from Chennai Hair Transplant Center and Vasanhaircare Clinic. Nowadays, awareness of maintaining the hair is growing among the public, mainly among the youth or youngsters. They want to retain the hair. By losing the hair, they are feeling so much bad, and sometimes they go into depression. And we are there here to treat all those clients in our own way. We are experienced in this field for past nearly a decade, and I am into this field for nearly around 4 to 5 years time. Today I am there in front of you to brief you more about platelet rich plasma, that is PRP. This is a hot topic nowadays in all the specialties, in all the field, where more and more specialist doctors are getting trained in this PRP and they are using in their own field. As a cosmetic surgeon, we do PRPs in cosmetic procedures, in various cosmetic procedures like fat fill, skin regeneration, and even recently we started in hair transplantation also. Platelets are nothing but the thrombocytes which are derived from the megakaryocytes, which contains a lot of growth factors, and various growth factors are derived from this one. But the major growth factors which are very essential for the hair growth are platelet-derived growth factors and vascular endothelial growth factors. Mechanism of action, how this PRP acts in the balded head or act on this balded head, how the new hair grows. Generally, if we say for balded, any balded people or balded person, if you take it closely, if you watch them, you can see the flimsy hairs or miniature hairs in their head. That means the hairs are there, hair roots are present in them, but it is in the inactive form. So those inactive hair roots require some triggering force from outside to make it active and hair to regrow again. So the triggering force are known as the growth factors, which is derived from this PRP. Initially, I have tried this PRP as a non-surgical procedure for first 5 patients. This is one of our patients. We are drawing around 15 to 20 ml of blood from his peripheral lines. Once this 15 to 20 ml of blood is drawn, we transfer that into the APC kit, that automated platelet concentrate kit. Okay, it has 2 chambers, and once this kit is placed in the centrifuge machine, and this is a dual spin mechanism. It undergoes clockwise direction and anti-clockwise direction for 15 minutes procedure. Once the centrifuge is done and the APC kit is collected, and very clearly you can see in the APC kit 2 chambers. One chamber where the RBCs has been taken away. The other chamber we collect that plasma, which contains top layer PPP, the platelet poor plasma, and the bottom layer is the one platelet rich plasma. Okay, and the platelet poor plasma top layer is discarded, and the PPP platelet rich plasma, which is at the bottom, can be used for the injection, and it is taken in the 20 ml of syringe and it is ready for use now. I used to inject into the scalp after the transplant, and whatever oozes out, I used to paste it over the scalp. Once after the injection of this PRP, I used to apply a thick coat of local application like Neosporin, or you can even use Regen D to form a paste over the scalp area, so that whatever the little amount of PRP which oozes out from the scalp, it won't be oozing out. It will be like paste, it will be sealed off completely. And once this is done, I used to apply a small dressing for a couple of hours. Then later I thought that if this procedure combined with hair transplant will give a good results. So later onwards, for past 1.5 years, I am combining this PRP with hair transplant, and we got a very excellent results in this past 1.5 years when I combined this procedure with hair transplant. Patients are happy and they found the hair growth immediately after 2 months of time. Usually when we do only hair transplant, we see the growth after 3 months or 4 months time, and even the rate at which the hair growth, everything matters when we compare with this PRP. And there is a drastic and a significant change once we use this PRP along with hair transplant. back to me. You have seen the procedure and you have seen the pre and post-op pictures, and it's quite interesting how the hair can change the whole look completely from a old look to a new look. This is what we do in our center, and this is about what we create. Graft intake is more. Suppose if we aim for 1000 or 1200 grafts, without the PRP, we expect somewhere around 900 plus hairs to grow. But when we use this PRP along with the hair transplant, our success rate increases more than 90%. So increased graft uptake and longevity of the graft is more, and survival of this graft is more, and we can keep on telling the advantages. Now to conclude, PRP is very safe, is non-allergic, and there is no transmissible diseases like HIV, AIDS, which most people are scared about it because of your own blood. It's autologous and there is no risk of any infection or any graft rejection. Wound healing time is decreased because of these growth factors. It also acts as a physiological antibiotic and is very easy, safe and convenient to use. I hope you enjoyed it. Thank you.